Overdone faces, botched up plastic surgery, botched up aesthetics, something that everyone is afraid of, and yet something that one sees a lot. The ideal plastic surgery is something that should not be visible on your face. But if it is visible, what do you do? Whom do you go to? Well, in this video, we'll be talking about all that we do to treat these overdone cases and how we fix them. Hi, I'm dr.saumil Shah. I'm the Director of Plastic Surgery at Skinzone Aesthetics in Borivali, West Mumbai. Overdone fillers, something that all of us know, something that is seen in so many celebrities, not just in India but in the Hollywood. But and if you're walking down the streets of any major city, even amongst the expensive parts of the city, you will see people with overdone faces. Now, first of all, why is this happening? Because it is being done by doctors who don't really understand as to what is causing the primary issue of aging. When people try to lift using fillers, when people keep doing fillers for indications which are not needed, and when a lot of filler is done in a way where, or in an area where it's not needed, it leads to this overdone filler look. Now there are a few ways how this can be treated. One, if it's basically HA fillers, the fillers will sort of be absorbed on their own and you can wait it out and then not do a lot more fillers after that, but wait and try correcting the primary issue that has led to the changes that the person was looking to sort of correct in the first place. Second, if somebody has a really bad filler done, especially HA filler, what there are injections called as hyalinase that can sort of dissolve this filler instantaneously. Under sonographic guidance, we basically put in the hyalinase, which is the hylase or the enzyme that dissolves this HA filler instantly, and you can get rid of this HA filler and the problems that it causes. If say it is a filler which are now slowly going to be introduced into the Indian market, which are non-HA, which are things which also lead to stimulation of collagen, which are basically called biostimulator fillers, and also fillers that are permanent and semi-permanent, that is when the problems happen. So I would also advise patients to do these fillers only in the hands of doctors whom you know will have your best interests at heart, who know what they are doing, and who have the entire armamentarium of aesthetics at their disposal so that everything does not become a nail. So that is how basically I would look at treating the fillers, is by hyalinase and then or letting it sort of settle and then doing what is needed for that phase. The second thing that patients often come to us with are poorly done facelifts or poorly done neck lifts. There are two very important things. A lot of the patients have unrealistic expectations as to what can be achieved with a face and a neck lift. They have seen the videos of the best patients of the best doctors in the world. These are patients who have had the best results that anybody has gotten on this planet, and they feel that that is the average result that every patient should get. So first of all, our patients need to be realistic and our doctors need to make them understand as to what can actually be achieved with a face and a neck lift on a regular average patient by a regular doctor. Now, if you feel that in spite of all of this, there are some things that have been really badly done. For example, there are skin folds. The ear is sort of fixed to the skin, to the face. There are signs where the scars have become really bad, or there is some burns, or sometimes there is also very severe asymmetry of the face. Then it's important that we sort of correct it or help out our patients a little bit. In people who feel that their facelifts and neck lifts are not completely achieving the results, but in patients who have had complications post this, in whom we actually look at correcting a lot of the surgeries. Say if it is something where we can go in, we can do without going in and doing the surgery again, we look at sort of things such as fillers or fat grafting or other things which can sort of mask the results or the problems that have occurred with the face or a neck lift. Say for some reason the face and the neck lift you've done, but it has problems which can only be corrected by opening it up. We may have to tell our patients that we would do the face and neck lift revision again. We may go in different planes, we may sort of correct some things that may need to be corrected, and that is how we would do it. So it's something that we sort of have to assess from a patient to patient basis, but yes, a lot of these problems can be corrected. So the third problem often is when maybe the rhinoplasties or the nose surgeries or the eyelid surgeries are not done perfectly and they are causing some severe problems. Then again, from a person to person basis, we'll have to see whether it requires some major tissue correction, whether we have to go in and do a major surgery, or some minor small corrections will sort of help cover up whatever issues have happened. So this is something that we'll have to take a look at. This is something that we'll sort of see as to from a patient to patient as to how it can be done. You'll need to come down for a consultation. We'll have to explain it, we'll have to examine, and that is how we sort of go ahead with correcting a lot of these problems. So yes, botched up surgeries are an issue. It's something that we look at correcting if it's a correctable issue. If it's something that cannot be corrected completely, or if it's something that we can just sort of mask using some non-surgical procedures, we'll be doing that as well. If you have any other questions regarding this, you can come and speak to me and we'll sort of let you know what can be done.